Hello, residents of Goodwin House, Alexandria and Goodwin House, Bailey's Crossroads. My name is Barbara D'Agostino, and I serve as the Executive Director of Goodwin House, Alexandria. On behalf of my colleague, Justin Carwell, Executive Director of Goodwin House, Bailey Crossroads, I am delighted to moderate this briefing on the coronavirus. We will now begin today's webinar. This webinar is being recorded so it can be played multiple times on our in-house television channels at GHA and GHBC, and residents can listen to this program at a time that is convenient to them. The playbook dates will be listed in the Gazette at GHA and the West Winds at GHBC. The pandemic entered our lives here at Goodwin House in late February, when we launched the Infection Prevention and Planning Team to guide our efforts to keep our residents, Goodwin House at Home members, and staff safe. 8 months later, the IPP team, as it's known, continues to meet regularly, monitor guidance from the Centers for Disease Control, and update our protocols to ensure the best possible quality of life for our residents, members, and staff, all while keeping everyone safe. The purpose of this program is to provide an update on Goodwin House's efforts to keep us safe and our future plans, and also an update on emerging research on the coronavirus, the state of treatments, and the vaccine trials now in final phases. It is now my pleasure to introduce Lindsay Hutter, our first presenter, and our next slide will feature Lindsay. Lindsay is a daughter, sister, aunt, and friend. Then she is Chief Strategy and Marketing Officer.
Barb
is intentional for her as she believes that aging well is a family affair. Each generation, from young to old, support, honor, and uplift one another. As some of you may know, Lindsay's mother is a resident of Goodwin House, Alexandria. Lindsay Hutter leads strategic efforts to fulfill and expand the Goodwin House mission and strategic plan. Lindsay also oversees Goodwin House's branding, marketing, sales, and communication efforts, ensuring current and future residents, members, employees, and guests feel warmly welcomed and well-informed, and that the organization meets its growth and revenue goals. Welcome, Lindsay.
Thank you so much, Barb. America is now in month 8 of the pandemic. We are grateful for the continued progress that is being achieved to understand the virus and keep people safe. At the same time, while we may be done with COVID-19, it is not done with us. Progress continues to be made on vaccines, that we know we will need to continue to follow safety guidelines and health recommendations until a vaccine is developed, and likely longer. I want to start by thanking the residents of both Goodwin House communities for your patience and support with the protocols and infection precaution measures. Those measures are working in keeping the presence of the coronavirus low on our campuses. Thank you. I also want to thank our residents for your tremendous support of staff during the pandemic, from your kind words and notes to your amazing generosity and contributions to the Goodwin House Foundation Staff Support Fund. To date, the foundation has received more than $500,000 in contributions for staff support during the pandemic and distributed hundreds of grants to employees. Thank you so much. I'll begin my part of this presentation by sharing an overview of the ways Goodwin House Incorporated is serving older adults through the pandemic, specifically through the services we offer our residents and other older adults across Northern Virginia. So as we transition to the next slide, I want to point out that you all know Goodwin House very well. Many people think of Goodwin House simply as Goodwin House Alexandria or Goodwin House Bailey's Crossroads. Goodwin House Incorporated is actually a senior living and healthcare services organization that serves more than 2,000 older adults across Northern Virginia. We have a range of professionals that serve our residents, our patients, our members, and guide our infection precaution and planning efforts during the pandemic, from medical directors to life enrichment and wellness professionals to dining and nutrition experts to home health therapists. These experts bring their knowledge to all the older adults served by Goodwin House. What you see here is an overview of the ways we serve older adults where they live, beginning with Goodwin House at Home. It serves older adults age 55 and above that want to age in place in their home. Of course, we have our two wonderful life plan communities, Goodwin House Alexandria and Goodwin House Bailey's Crossroads. And in addition to that, Goodwin House Incorporated is the management agent for a low-income senior housing community in McLean, Virginia. This community, the Lewinsville Retirement Residence, serves over 130 older adults. As we transition to the next slide, you'll see that as Goodwin House serves older adults where they live, we also bring them a variety of services. These services include Goodwin House Home Care, our private duty home care, which supports our residents in both communities. We also have Goodwin House Rehabilitation and Home Health Services. Our rehab services serve residents on our campuses, and our home health service, in addition to serving residents, also serves older adults across the region who may be aging in their home or reside in other senior living organizations. And of course, we have Goodwin House Palliative Care and Hospice. Our Goodwin House Hospice program serves our residents, and it also serves older adults who are aging in place and need care in their home, or may live in another senior living community that does not have a hospice service. So what does all this mean? It means that when you join the Goodwin House family, you have a full and integrated suite of home and healthcare services to keep you well and thriving, especially during this pandemic. Thus far in 2020, Goodwin House has invested more than $5 million to keep our residents, our members, and our staff safe and healthy during the pandemic. As we transition to the next slide, I want to highlight what are really the three principles that have guided our efforts: leadership focus, a proactive approach, and a mission mindset. So if you focus on the left column of this slide, it says leadership focus. And what you see there are photos of our residents engaged in activities on both campuses. Our entire senior management, over 55 individuals, is involved daily in your safety and your engagement in community life. We have a balance that we have to strike, and it's a balance of safety and socialization. Safety came first back in February when we started our infection precaution and planning efforts, and it will continue to come first. Without safety, there can be no safe socialization. If you hearken back to March, April, and May, we were setting up the systems for safety. In June, we were able to bring in-person socialization back into balance, with off-campus restrictions also lifted and family visitations being reintroduced. That is the balance that is in constant review with the Goodwin House management. And it is right now as we head into the Thanksgiving holiday and the precautions that we are advising for this holiday and family gatherings. Now let's look in the middle column where you see proactive approach. That proactive approach begins every morning with the infection precaution and planning team. We start our days with a canvas of updated regulations, updated guidance from the Center for Disease Control. We also review what are the news headlines on the virus, what research is out, or what new information on the vaccines and treatments. Today, the day we recorded this webinar, our focus was on the fact that America had just hit a new high in daily COVID positive cases. And we were focused on what does that mean for our hospital partners? What does that mean for PPE supplies as we head into winter? We were also focused on news that the federal government, the Centers for Disease Control, and a number of safety advisory committees that are monitoring the vaccines for COVID are putting in place early detection outreach to particularly the most vulnerable citizens that will receive the vaccine. This gives us confidence in the vaccines that are moving forward and the fact that those who are entrusted with our health and safety will be actively monitoring any immediate reaction to the vaccines once they are administered. So that's positive news, and that is the way that your leadership focuses every day. What's the new news on the virus? What's the new news on treatments? And how can we apply that to the life and the safety and the care of our residents and our members. Now there's two photos under proactive approach, and the one is focused on testing. That's actually a photo of the early days of testing when we started testing for COVID in May. Goodwin House was one of the first senior living organizations to proactively roll out testing. And we've maintained our testing because we want to focus on your safety and be able to catch any asymptomatic cases. That's why you're tested about every 4 to 6 weeks. It's for everyone's safety. We also have been very proactive about securing PPE. You may recall that back in April, we coordinated a group buy of PPE with nearly 60 organizations, hospitals, other senior living communities, doctors' offices, because we weren't able to get the PPE we needed at the size we were. So we did group buys where we were able to go on the global markets and purchase literally in the hundreds of thousands of cases of PPE. The photograph you see here in the middle column, the lower photograph, is our corporate director of supply chain, Lisa Wallace, and the Reverend Marcia Norfleet. Reverend Norfleet is with the Alfred Street Baptist Church. That's a historically Black church in Alexandria. We were able to help that church and many others obtain PPE for their older congregants to help keep them safe. That proactive mindset continues today. Now the right column, you'll see it says mission mindset. And this is really reflected in saying that as we have learned how to make our community safe, help keep our Goodwin House at Home members safe and our staff safe, we want to share that information. To date, Goodwin House has adopted 225 protocols for our infection precaution efforts. We looked up in August and said, wait a minute, we've been on the front line. And if we were able to take our templates, our tools, our protocols, and share them with other organizations across the region, that would help keep them safe, and it would keep the regional positivity rate for COVID as low as possible. And that keeps all of us safer. So we coordinated all of our templates, our protocols, our tools, and we put them in a playbook. And the image that you see is our COVID playbook. We published that starting in early September, free of charge. We wanted as many organizations to be able to use it as possible. I can tell you to date that over 200 organizations across the United States have used the COVID playbook. This includes schools locally in Alexandria, in Arlington, churches, nonprofits, and other types of businesses. That's the Goodwin House mission mindset, and we'll continue to do all we can to help others learn from our experience. So, what have all these efforts translated into? Let's take a look at the next slide. And what you'll see in this next slide is an overview of the volume of our efforts. First up, testing. Think about the fact that in April of 2020, no one on the Goodwin House staff had ever conducted a COVID test. And today, we've conducted over 10,000 tests to keep our residents, our staff, and our hospice patients safe since May. We initiated partnerships with 4 different lab companies, and we've now conducted over 300 tests for other organizations who said, can you help us get started on our testing program? In the middle column, I reinforce what I mentioned just a minute ago, that we have helped over 60 local organizations receive PPE at significant discounts. To date, we've ordered more than 950,000 pieces of PPE. Think about that, almost 1 million pieces of PPE just in 1 year. Engagement is also part of what we do. I talked about that balance of safety and socialization. Early on, when we realized it wasn't safe to meet in person, we immediately pivoted to develop virtual events for our residents and our Goodwin House at Home members. To date, we've conducted over 1,400 virtual events for residents. On average, it's about 30 in-person events and virtual events every week per campus for independent living. And it's 20 in-person events and 20 virtual events for our residents in higher levels of living each week on both campuses. We've also conducted over 30 weekly virtual meetups for our Goodwin House at Home members. So you see there's been this tremendous investment from the beginning on safety and safe socialization. Now, as we transition to the next slide, I want to review what that's meant in the way of how we've been able to keep our COVID case counts low. This chart shows you how many residents and staff for each of our communities have tested positive. I also want to take a moment to remember those residents that we lost to COVID complications this year, 3 of them from Goodwin House Bailey's Crossroads. We also had 1 from Goodwin House Alexandria. We also want to show you the ways in which our service lines, Goodwin House at Home, Goodwin House Hospice, and Goodwin House Home Health, have weathered the COVID pandemic. You'll note that our Goodwin House Hospice program, and they're shown in the middle, have served 40 different non-Goodwin House residents who have been hospice patients that tested COVID positive. All of this shows you that Goodwin House is here to serve older adults, even when it's very challenging. As we transition to the next slide, there is just a lovely story to tell here. Many of you may have seen the Washington Post article. It was published on November 2nd, and it was about nursing homes that have adopted the small house model and how they fared during the pandemic. We were thrilled that Goodwin House Small House Administrator Josh Begley and Goodwin House Small House resident Mrs. Ruth Deardorff were featured in this photograph that accompanied the article. And it tells the story that we have been able to weather the pandemic with no healthcare residents testing positive for COVID at Goodwin House Alexandria. We'd like to transition to just one more slide to show you. And this takes you inside our communities. And this is just some visual imagery of the way engagement happens. And this is bringing the outside inside. Some of you may be familiar with Elder Grow. That's a program where we bring in plants and herbs inside the communities for residents to maintain. These are images of residents at the terrace at Goodwin House Bailey's Crossroads who are participating in this therapeutic horticulture garden and culinary herb garden. We also have more examples of residents that have been active during the pandemic. And the next slide shows you some residents and some staff members who were involved in the Alzheimer's walk. We couldn't participate on the National Mall the way we did last year, but we still participated at both of our campuses. And that is just a wonderful demonstration of the way our residents continue to have a purpose in their life, causes that mean so much to them. As we transition to the next slide, I want to use this as a reinforcement of what has been an absolute commitment of Goodwin House to our residents and our members and our staff. And that's to be absolutely transparent with what our protocols are and what our case count is. The photo that's before you is our website, the Goodwin House website. We have a whole section on the website that's dedicated to our COVID protocols, our case counts, and updates. We want the loved ones of our residents and our members and our staff to go to our website and be able to find out all the information that they need. We update it at least every week with our updates to residents and our case count. So we've said we're going to be transparent and everyone will know our situation. As we transition to the next slide, you're going to see another photo from our COVID web pages. These are examples of different resources that we've made available to families and older adults all across Northern Virginia. We've taken some of our programs, we've taken our resource guides, our tools, and we have put them on the website to say if they can benefit other older adults, then that is a good thing. And that is part of our mission mindset and our give back and gratitude for the many blessings that we have. We continue to keep our resources current on the website. I encourage you to go visit and see what's there. So that concludes my part of the presentation, and I'm going to hand it back to Barb. Thank you, Barb.
Thank you, Lindsay. It's been my pleasure to serve as a member of the Goodwin House Infection Precaution and Planning Leadership Team with Dr. Maggie Gloria the last 5 months. Dr. Gloria is the medical director for Goodwin House Hospice. You will find her to be a calm, thoughtful voice on the coronavirus, and we are grateful for her daily wisdom to inform our safety protocols. Dr. Maggie Gloria completed her fellowship training in hospice and palliative medicine, as well as internal medicine at George Washington University. She is board certified in internal medicine and hospice and palliative medicine by the American Board of Internal Medicine. Dr. Gloria proceeded a step beyond the American Board of Internal Medicine certifications to earn the Hospice Medical Director certification in order to become a hospice medical director. Prior to joining Goodwin House, Dr. Gloria served on the inpatient palliative care team at George Washington University Hospital. Dr. Gloria is here to provide residents with an update on the coronavirus from a medical perspective. Welcome, Dr. Gloria.
Thank you so much, Barb, for that introduction, and welcome everyone. I'm so glad that you could join us. So on my first slide, I'm going to talk a little bit about, I'm going to give us an overview about what we're going to talk about during the presentation, and I'm really going to try and focus on what we've learned since the start of the pandemic in March. I'm going to pause just a moment so the slide can go forward. Sometimes there's a little delay. There we go. So Lindsay kind of already alluded to the fact that, you know, when this all started, none of us had ever done this before. None of us have ever seen a pandemic like this. And so we were all kind of starting from scratch, but we've learned a lot in the process. What were once trial treatments are now becoming more the standard of care. The infection precautions that we've been using are working, and I'm going to talk a little bit about that further in the presentation. Vaccine trials are promising, they're ongoing, and they're rigorous so far. We'll touch on that. And then we knew that the likelihood of the fall and winter surge was coming, and so we've actually had some time, as Lindsay already alluded to prepare. So we've had time to gather PPE, to really work on our testing protocols, et cetera, et cetera. So we'll talk a little bit about that too. I'm going to sprinkle in just a little bit of a personal reflection on the next slide. And that is what I've learned since the start of this pandemic. I've had to really do some thinking for myself and come to terms with the fact that when this started in March, in February, I was really thinking in the short term. I was thinking a lot about getting us through that first wave in the early spring. But more recently, I've realized that this is going to be a marathon and not a sprint. And so we need to start thinking about how to live with COVID-19 and not just thinking about once the vaccine is here or once we're past this wave or what have you. I put on this slide, it's like the flu in the sense that it's going to be around even after the vaccine, even after good treatment options. This is probably going to be something that we're going to have to deal with some seasonality. And so we're going to have to know our risks and how to minimize them. Unfortunately, I want to point out it is not the flu. It's worse than the flu, but we're going to live with it like the flu, and we're going to go on together. So let's review a little bit about the state of the pandemic. We're going to talk on the next slide about kind of the pandemic as a whole in the United States. I'm sure you've noticed in the news the last few days, we've hit some unfortunate milestones. Yesterday, we had 120,000 new cases of COVID-19 diagnosed in the United States. That's the highest that it's been so far. So if you look at this graphic on the left-hand side, this is from the New York Times. It's a chart that basically represents the total number of new cases reported every day. The dark red line on the top of the graph is the 7-day average. So what they do is they take that day and the 6 previous days, they average it to get that dark red line, because you know there's outliers here and there. So that helps you to kind of see the flow of the curve a little bit better. You can see we had that initial peak in the spring. I think we all felt that. That was when we were really shutting down. You know, we were feeling it here in this area. And then we had a peak in July and August that I honestly don't think we felt as much here in this area, because we actually did pretty well. That was more in the middle of the country, and we'll look at the map on the right in just a second. And then that brings us to kind of October, November, where we are now. We are experiencing that dreaded fall and winter peak that we had been warned about. And like I said, that's right in line with the milestone that we hit yesterday with 120,000 new cases. So if you look at the map on the right-hand side, that's a representation of where the hotspots in the US are now. The red areas are the areas where they're experiencing more COVID cases. And then it goes through the spectrum to the yellow cases where they're experiencing less. The gray is where there's either no data or there's so few cases that it kind of didn't even make the map. So you can see in some of the Midwestern states, they're really having a hard time right now with a lot of new cases. Here in our area, we're more in the yellow and orange colors, so we're doing okay. For the whole United States, we've had a total of 9.6 million cases of COVID-19 diagnosed since the start of the pandemic. We've had just over 230,000 deaths, unfortunately. So let's go to the next slide and talk a little bit about the state of the pandemic here in our state, in Virginia. So this is a graphic from the Virginia Department of Health. It's the same kind of curve that we looked at on the previous slide from the New York Times, but instead of representing all of the United States, it represents the number of new cases reported each day just in the state of Virginia. And instead of a dark red line, we see a yellow bolded line at top, which is the 7-day average number of cases reported. So you can see, if you look, there's a curve in the spring. Like I said, I think we all experienced that. That was, when the shutdowns were first happening, we had a lot of cases in this area. Then the curve falls in June, it peaks again in July, and it's been fairly steady, kind of bouncing up and down, but certainly not low since July for the state of Virginia as a whole. So let's actually take that data and look a little bit more closely on the next slide at our region specifically. So if you look at the graph on the left-hand side, that is the number of cases reported per day just in the Northern Virginia region, so just in our area. You can see on that curve, we had that initial spike in the spring. Again, we all felt that. And then since our case number has been fairly stable over the last couple of months, you can see we're starting to see a little bit of an uptick. That's to be expected. That's that fall and winter wave that we all knew was coming. And with the number of cases going up the way that it is around the country, of course, it's not unexpected to see that we're having a little bit of an uptick in our area. If you look at the graph on the right-hand side, that is the state of Virginia that's just excluding the northern part. So that's the whole rest of the state. And you can see they also experienced a spring spike. Their cases, unfortunately, have been actually much higher since June and July. So compared to the rest of the state, we here in this area, Northern Virginia, are actually doing pretty darn well, which leads me to my next point on the next slide. I think that the precautions that we're taking, they're working. I think here in the Northern Virginia area, people are pretty good about washing their hands, social distancing, covering their face, not touching their face when they're in public. We want to keep all these things in mind. Keep in mind that any environment that's an enclosed space with poor air circulation, where there's going to be a lot of people, is going to be high risk. And of course, although now we realize probably less risk, those surfaces that could have viral particles on them, like your cell phone, food packaging, the steering wheel, doorknobs, just making sure that we're all being cautious of that. But I think this is something that we all do every day now. And clearly in this area, we do it well, and it shows in the data that we just looked at. So while we're on the subject, let's go to the next slide and review a little bit about masks. Get a lot of questions about masks even still. So a good mask should cover your nose and your mouth at all times. The best kind of mask for everyday use is a cloth mask, and it should be made of 2 layers. And the best material they say to use is a cotton blend, so something that has a little bit of a tighter weave. So you can see a picture of the maroon colored cloth mask the woman is wearing up on the top left. That's what I'm referencing. Those are good for everyday use. Those can be washed, and they should be washed in the highest temperature that they can handle in your washer. I don't dry mine because I wash mine in hot water in the washing cycle, but you can dry it if you want that extra layer of protection, because it gets pretty darn hot inside the dryer, and coronaviruses do not like the heat. So that's a pretty good way to kill that. But again, those should be washed every time you use them. Those are kind of like, you wear it out, you take it off, bring it home, and you wash it. I wanted to point out a couple of masks that are not recommended for use. One is the gator style mask that you see in the picture in the middle. Studies have shown that because the fabric weave on those masks is usually pretty large, that actually worsens your chance of spreading COVID-19, because as you exhale those respiratory droplets, that large weave in the fabric actually breaks those particles up and makes them into smaller particles, which are more dangerous because the smaller particles float around in the air for a longer period of time. The larger particles tend to sink faster. The other kind of mask that the CDC recommends against is a mask like on the bottom left-hand corner, you see a KN95 mask that has a valve in it. The reason that they recommend against those masks is because it does protect the wearer, but that valve makes it so that other people around you don't have any protection, because whatever you're exhaling is going right through that valve. On the right side of the slide, you can see there's two different types of masks that are recommended for healthcare workers. One is the surgical mask, and then the other one on the bottom is the N95 type respirator. Surgical masks, I mean, at this point, they're probably not in as much demand as they were previously when the CDC was saying, please, if you're just the general public, don't wear those surgical masks. Now, if you can get your hands on them, I don't think there's anything wrong with wearing surgical masks. They cannot be reused. They should, if you want to try and reuse it, you should sterilize it using UV light if you can do that. So leaving it in the sunlight on each side for a half hour, but don't try and microwave it. Don't try and heat it. Do not try and put it in the washer. The other thing that you can do is if you wear a surgical mask, if you take it off and you leave it somewhere to quarantine by itself for a week, that's enough time that any viral particles would die in that time. But that's not something you want to wear every single day and be touching and then putting back on your face, because you could potentially be spreading COVID-19 that way. And then as far as the respirators go, those are really best used when they can be fitted to your face. And that's how healthcare professionals usually use them, as we go through a whole process to make sure that it's fitted to your face, it's fitting correctly, and that it's not leaking around the sides. So those are probably best left to healthcare professionals. Jen, if you could click the slide just once, I put in an extra picture here. There you go, because I've heard a lot in the news about these new masks, which look really fantastic because they're clear. And I've heard a lot of talk about people who are hearing impaired and how nice these masks are so that you can actually see people's lips. Unfortunately, I don't think that these are a good idea as far as the safety goes and the spread of COVID-19. All the other masks that I talked about, they work because they cover pretty much your entire face to trap any of those respiratory particles that you're exhaling or inhaling for that matter, but also because they're semi-absorbent. So any of those droplets, those particles that you're exhaling, the thought, the idea, the hope is that they're getting caught in the fabric of the mask. But if you're wearing a plastic mask like this, it's hard for any of those particles to actually get caught up, and they're probably just coming out or going in through the sides of the mask here. So right now, this is not one that we recommend. We need probably a little bit more time to develop this concept a little bit more before we can recommend this one. All right, so let's move to the next slide and we'll talk a little bit about treatment updates. I mentioned, in the beginning that we were going to talk about how some of these treatments were originally experimental and now they're starting to be the standard of care. There's been more and more data on remdesivir. Some studies have been mixed, and I think it really depends on what endpoint you're looking at. So some studies have shown that the mortality, so the odds that somebody would die of COVID-19 if they received remdesivir, is not different between the placebo group and the remdesivir group. But there have been a lot of studies that have shown that remdesivir does help shorten, the time that it takes for people to get better. So it's doing something. The good news is that we're getting more and more data on it, and that's what we're all looking for. That's what we want. Regeneron's REGEN-CoV-2 antibody is gathering steam. They're gathering more data, starting clinical trials on that. That is basically a manufactured antibody that you could give to somebody that had COVID-19. The hope is that that would boost their immune system to be able to fight it. Dexamethasone is continuing to gather data. It works, it's showing good results in patients, and it's continuing to be used more like the standard of care than, like previously in experimental treatment. Let me just go back. I missed pointing out remdesivir has actually been approved by the FDA. I want to say it was on October 22nd. It's not just approved for emergency use authorization. It is approved by the FDA for use in hospitalized patients that have COVID-19. So again, just more proof that we're gathering more and more data on these treatments and their efficacy. So that's very good. Let's talk a little bit about the vaccines. So on the next slide, I have a graphic that shows, this is again from the New York Times. This is like a vaccine tracker graphic. And so it shows basically all of the vaccines in the world where we're at. We have 36 that are in phase 1 trials, 14 in phase 2 trials, 11 right now in phase 3 trials. There are 6 vaccines that do have limited use authorization in other countries like China and Russia. So there's that. I wanted to talk a little bit about some of the vaccine companies that are more relevant to us, because they're either companies that are here based in the US or based near us, or where the US government has already tried to establish some contracts with the vaccine manufacturers so that when the data is complete, when the vaccine gets approval, we can start purchasing those vaccines for patients here in the US. So the first one I wanted to talk about is AstraZeneca. They've partnered with Oxford University. They are doing combined phase 2, phase 3 clinical trials. Their vaccine is a viral vector vaccine. So that means they take another virus that's totally harmless, like an adenovirus, and they add some of the DNA from COVID-19 into that adenovirus and then incorporate it into the vaccine. And that's how it stimulates an immune response. This trial was actually paused here in the US from September 6th to October 23rd. It was restarted in other countries sooner. The FDA held it up here for a little bit longer. One of the participants experienced a complication called transverse myelitis. And so the FDA is doing what it does. And it just wanted to make sure that it had a little bit more safety data before restarting the trial, but it's up and running again in every country. And so they're going to continue to collect data as they do. The next vaccine I wanted to mention is from Moderna. So that's a US-based company. They are partnered with the NIH. They are also in phase 3 trials. Their vaccine is a genetic vaccine. So it's actually little pieces of viral DNA that gets incorporated by our bodies and then picked up by our immune system as foreign. And that's how it makes antibodies. The US government has invested over $1 billion in the development of this vaccine, and they've started to try and negotiate contracts with Moderna so that when the data is out and when the FDA decides that it's safe, they can start rolling that out. Moderna actually thinks that they may have data to hand over to the FDA by the end of this year, so that would be great. Johnson & Johnson has also a viral vector vaccine. They're also in phase 3 trials. Their trial was paused October 12th for about 11 days because there was a complication, but I never heard any real details about it. And I think what ended up happening is that the complication had occurred in somebody that had received the placebo. So they realized it did not have anything to do with the vaccine. But again, that's how these trials work. It's not uncommon to pause trials and then restart as they're gathering data. That's the whole point of these phase 2 and 3 trials, is to make sure that whatever they're studying, if it's a treatment or a vaccine, is safe. So Pfizer is in combined 2 and 3 phase trials, and that's an American company. I think it's a very common company that we get a lot of medicines from. But anyway, Pfizer is a big one. They also have a genetic vaccine similar to the one that Moderna is developing. Novavax is a company that's based in Maryland, very interestingly, so very close to home. They have a vaccine that's completely different from the others I've mentioned. It's a protein-based vaccine, so it does not include any genetic material from the virus at all. It includes proteins. And so when your body sees these proteins, it realizes that they're foreign and it mounts an immune response to those proteins. It's important to point out that for all of these vaccines and the trials and the data that we're trying to collect, between the federal government all the way down to the very, the private entities like Goodwin House itself, we're all talking about, how to roll out these vaccines safely, how to make sure that the people that are at the highest risk get these vaccines first, which the federal government has already said that they're going to really try and make sure happens, which is great. So the planning's already in place, even though the vaccines themselves don't have approval yet. So it's good to know that people are thinking ahead so that when we do have enough data, we can go forward pretty quickly with that. I just wanted to plug the flu vaccine. The flu vaccine does not help for immunity toward COVID-19, but it certainly does reduce your risk of getting the flu or having serious complications from the flu. So encourage your loved ones to go ahead and get their flu vaccine. Very important this year, because you don't want to end up in the hospital with the flu or at the doctor's office with the flu, because it just increases your risk of being exposed to COVID-19. Last but not least, on the next slide, I just wanted to give you guys a real quick update on testing. So PCR remains the gold standard. PCR stands for polymerase chain reaction, and that's when we take a sample, usually from your nose, and we send it to the lab, and they use a process that amplifies the genetic material there. They're actually looking for viral genetic material. It's just like when they use DNA evidence in court. If your DNA is at the crime scene, it's hard to prove that you weren't there at the crime scene. Same for these tests. The PCR tests are pretty sensitive. They're pretty reliable. If the genetic viral material is there, it's hard to argue that that person does not have COVID-19. The newest and upcoming types of tests are antigen tests. You've probably seen some buzz in the news about these tests. These actually look for proteins that are found on the COVID-19 virus, which is actually technically called SARS-CoV-2. So these proteins are specific to SARS-CoV-2, and so these tests pick up these specific proteins, not the genetic material itself. They are, it looks like so far with the limited data that we have, a little bit less sensitive than the PCR test, but they're much quicker and they're much easier to run. So these are tests that we can actually run at Goodwin House, at doctor's offices, at the hospital, and they take 15 minutes versus the days that it takes for the PCR tests. So these are promising. We're going to have to think about how exactly to use these tests safely, but they're really promising and they're really exciting. And then antibody tests are still around. A lot of the popular labs like LabQuest and Core, LabCorp and Quest for the antibody tests. They're not real helpful for us right now because they reflect that you've been infected in the past. Right now, in the going into another peak in the fall and winter, we're really trying to focus on people that are currently infected with COVID-19. So they're in the background. They may be more helpful to us further on in the future, but right now they're not really big on the scene of testing. So let's pivot a little bit from there, and we're going to talk about the ways that we can approach the holidays safely. The CDC has come up with some guidelines, which I actually have on the next slide. I literally copied and pasted these guidelines from the CDC because I didn't want to change anything that they said. But so this is what they want us to be thinking about as we're coming into the holidays. When we're thinking about holiday gatherings, we want to think about the community levels of COVID-19. So I already talked about in this area, we're doing fairly well. There's other areas of the country where they are not doing very well. So if you lived in an area where the cases of COVID-19 were very high, you would probably want to take that into consideration while you were trying to make plans to celebrate the holidays with your loved ones. You can check the positivity rate in your area by looking at the local health department's website. So in this area, I commonly check Fairfax County, Alexandria, and Arlington counties' websites, and they always have it posted there and updated. The other thing you want to consider is the location of the gathering. Is it going to be inside? Is it going to be outside? If it is inside, what does that area look like? Is it a large room? Is it a small room? And think about your risk in those terms. The other issue is the duration of the gathering. The CDC has recently updated their guidelines to say that 15 minutes total, so even if that's broken up, is considered, at the point at which you are taking a risk of transmitting COVID-19. So if you're going to be in an area for a prolonged period of time, it's something to consider. The number of people at the gathering, I know that it can feel awkward if you get invited somewhere to ask, well, how many people are going to be there? But I think right now, all of us are just thinking about, our safety and the safety of everyone else around us. So it's, at this point, really acceptable to just say, well, where is the gathering going to be? How many people are going to be there? What are the things that we're keeping, on our minds here? So you want to think about the location that the attendees are traveling from. I don't recommend anybody attend a wedding at this point, but let's just imagine if you had been invited to a wedding, that would be something that you would want to think about. What area of the country are the other people coming from? Because our cases, again, are low here, but that's not the case everywhere. What are the behaviors of the attendees prior to the gathering? So, if I'm ever invited, I don't go places very often, but if I am, I think about, well, who's going to be there? Do I know those people? Is it a friend from my kid's school? How do I know? Are they quarantining? That all has to do with kind of weighing the risk and benefit. The behaviors of the attendees during the gathering. So what are we going to be doing? Are we going to be eating? Are we going to be singing? Are we going to be laughing? Because all of those things can increase your risk of spreading COVID-19. So is this a gathering where we're going to be socially distanced? We're all going to keep our masks on? That makes me feel a lot better about getting together than hearing that we're going to be in a small room where everyone's, eating, for example. And then the other thing to consider the CDC wants you to think about is the behaviors of the attendees after the gathering. So if you do choose to go to a gathering for Thanksgiving, let's just say, really, really important to think about the fact that if you've taken a risk, you should plan on quarantining. The CDC recommends for 10 days afterward. So what do you have going on in your life? Can you quarantine for 10 days after you've been to that Thanksgiving dinner? Really important things to consider. I think especially when we live in a congregate setting, because the risk that we're thinking about is not just for ourselves, but it's for all of our neighbors that live with us. On that note, I want to close on the next slide with a really important topic. So we talk about the risk of transmitting COVID-19, and of course, that is at the forefront of all of our minds. But the other thing I want to talk about is the social isolation, and that it's real. So in the medical community, we are gathering a plethora of medical information, medical data on prolonged social isolation, particularly in the elderly, and the devastating effects that that is having on people. So I only bring this up. This is the picture on the slide. You can see it's just a couple of articles. Like I said, I mean, there's hundreds out there that are being published on this subject. I only bring it up to say, we see it, we know that it's real, we recognize it. And I think it's really important for all of us to try and keep in mind as we're balancing, you know, the safety of trying to control this pandemic. So to bring it home and to add on the last, very, very last slide this time, another really personal reflection for you all. There's this concept of pods. So these are my in-laws, actually, my mother-in-law and my father-in-law, and that's my oldest son. So when my kids were born, my in-laws were there day one. And to be really honest with you, they've basically raised my kids for the past 9 years. I was gonna say they've been very involved in our kids' lives, but let's be real. They've been involved every single day. At the start of the pandemic, they decided to quarantine in their apartment. They haven't seen us or our kids other than some very brief outdoor gatherings where they've, you know, been socially distanced. And I think it has taken a devastating toll. You know, my mother-in-law has expressed, my youngest son forgot the other day that he's not supposed to touch his grandma, and he held her hand, and she said, that feeling of his little hand in hers after she hadn't felt it in months was just, you know, something that she couldn't even get over. So we've talked as a family about creating a pod. You've probably heard the concept of pods, you know, in the media. And so we were hoping, I don't know that this is going to be the case, but we were hoping to actually move in together as a multi-generational home before the holidays, so that that's how we could approach our holiday plans. I don't think that's actually going to be happening, honestly. And so for the holidays, I think we're probably actually going to not get together, because that's just going to be the safest decision. And that's the decision that our family has made. But as you're thinking about your holiday plans, you know, I want you to think about the concept of developing a safe pod. So you want to include a small number of people that you know are also following the guidelines that you're comfortable with, and then making decisions based on that, so that, you know, we can get through and be safe as far as COVID-19 goes, but also know that we're protecting our own mental health and our well-being and our quality of life with having, you know, to deal with all this social isolation. So that concludes my remarks, and back to you, Barb.
Thank you, Dr. Gloria, for a highly informative update on the coronavirus and the progress that healthcare professionals and others are achieving to keep us safe from the virus. We now turn to the question and answer segment of this briefing. I want to thank residents for their thoughtful questions that have been submitted. I will read residents' questions, and Dr. Gloria, Lindsay, and I will answer them. Our first 6 questions go to Dr. Gloria. So Dr. Gloria, what is herd immunity? Is it something we strive for or something we try to avoid?
So herd immunity is the concept that if you've either been infected with COVID-19 or you've been vaccinated for COVID-19, that makes you immune. So somebody that is immune cannot get sick from COVID-19, and more importantly, they can't spread it. So the concept of herd immunity states that basically once 60 to 70% and upwards of the population are immune to COVID-19, the chance of it spreading the way that it is now and us having these huge waves and spikes in cases is going to be slim to none. So we've seen this with a lot of other infectious diseases in the past as we've developed vaccines. Polio, for example, is a great example. So many people are immune, so few people can actually spread the virus. It creates herd immunity. And so it's something that we definitely would want to strive for. My hope is that we don't establish herd immunity because everyone's been infected. You know, my hope is that we get to herd immunity because we have a vaccine that works.
Okay, the next question is for you. Can you discuss viral vulnerability for the older adult population in terms of relative risk given medical issues other than age?
So we know from studies that were done early on in this pandemic with tens of thousands, hundreds of thousands of patients, that people that have comorbidities like high blood pressure, heart disease, lung disease, kidney disease, are at higher risk for having complications of COVID-19. There were also some studies done that showed that regardless of medical comorbidities, age alone is a risk for having complications with COVID-19. So if you're over the age of 65 and otherwise perfectly healthy, you are still considered to be at the high risk category.
Thank you. And also, Dr. Gloria, does wearing a mask protect me or you?
That's an excellent question. It protects us both. At the beginning of the pandemic, we didn't have a lot of data. We're starting to gather more data on that subject so that we can speak a little bit more intelligently. It definitely protects other people when you're wearing a mask because it keeps those respiratory droplets to yourself. But again, there's more and more data that's showing it actually protects you, the mask wearer, in case those droplets are out in the environment around you.
And can I safely fly to visit my family over the holidays?
That's a really good question. And I don't have a straight answer for you, honestly. Safely is a relative term. If you choose to fly, you are absolutely taking a risk that you could contract COVID-19. There are things you could do to try and reduce your risk. You could try and get tested. You could wear a mask on the plane. You could social distance while you're in the airport. There's certainly things that you could do, but that is absolutely a risk.
And what's the status of a vaccine? And will Goodwin House be offering this?
Yeah, so we are working tirelessly to try, see, I'm so tired, to try and get a hold of the vaccine and make sure that we have it to offer our residents should they choose. We're trying to make policies so that we can implement vaccination programs and such. We are working on it. We would very much like to be able to offer the vaccine to those who want it.
And the last question for you, Dr. Gloria, is there a way for Goodwin House to facilitate COVID rapid tests for family members through your provider?
So we are actually trying very hard right now to maybe set up a test run to use the antigen test for family visitations around the Thanksgiving holiday. That being said, these new antigen tests are actually very hard to come by. And so that's part of the problem, is just obtaining the tests alone. As I know you've read in the media, that's been a problem all throughout the pandemic. But yes, we are actively, as a leadership team, working on trying to implement a program where we could possibly provide that for families that want to visit.
Great, thank you. And the next 5 questions are for Lindsay. Lindsay, is there a plan to reopen to family visits indoors?
It's a great question, Barb, particularly as we are coming to the end of what's been a really warm fall, unseasonably warm fall. And so if you go back to what I said at the beginning about the leadership focus, this balance of safety and socialization, and the importance of being able to connect with family and friends. We're actually working on 2 different types of potential indoor visitations. And one would be to identify rooms that can socially distance and would have egress from the outside. So visitors could come directly into those rooms and meet with their resident loved one. They would need to go through all the cautions and screening measures that we have in place and continue to have a negative test. Another method that we're considering is to create a room where residents could be and have a tented area outside where loved ones could be, find a way to keep that warm, and then have a private phone connection so they can see each other, but they're not actually in the building. So we're working on a variety of different potential options to make sure that, to the extent safe and possible, we can have indoor visits. It's important to note that we're on a sliding scale. And as the regional positivity rate goes up, if we're to have outbreaks on our campuses, then we have to increase the restrictions. So this is something that is, if you will, a moving target, but we're absolutely doing everything we can. The other consideration in this is our effort to obtain rapid test and to be able to use the rapid test as a point of entry testing mechanism for family members to come in and see their loved ones who are residents in our communities.
Thank you. And what can this organization do about the damage of enforced solitude and the anxiety and harm caused by social isolation and uncertainty because visitors are no longer allowed? In particular, for those residents in assisted living and healthcare and in independent living, I know the social workers are busy dealing with residents who are failing to thrive in this milieu without family and friends visiting regularly and frequently.
Barb, it's a great question. And just this morning, the day we're recording this, November 6th, the IPP team heard from Liz Pomerlau. For those residents who don't know Liz, she is the director of our clinical pastoral education program. And the interns who are pastors and wanting to gain knowledge of working with older adults, they are focused on outreach to all of our residents. So we're actually increasing the outreach from the CPE pastor interns who are with us to try to create one-to-one contacts and conversations. In addition, we continue to make all the plans that we can for what are virtual connections with family members. There is a high degree of that taking place in the higher levels of living, in healthcare and assisted living for those residents and their loved ones. And as a daughter of a resident, I haven't been to my mother's apartment since, I think it was the first week of March. And that was right before we did no longer allow any visitors on our campuses. It's very personal for me. I get what families and their loved ones are going through. And we're doing everything we can with virtual while realizing it is not a complete substitute. I think we were all touched when we heard Dr. Gloria talk about her mother-in-law saying, when I felt that little hand in my hand, gosh, we want to restore that as soon as we can. And so our proactive efforts around being able to obtain the rapid test, that's one of the ways that we can try to get closer to in-person visits with family members and their loved ones who are residents.
Thank you. And Lindsay, we realize there's an urgent need to not let this lethal COVID virus into our community. All of us residents realize there's a fine line in opening up. Nonetheless, we mourn what we residents have lost in connectiveness because all of us residents are yearning for socialization. What are the possibilities of the availability and implementation of a quick, reliable COVID test to screen family or other close friends, including weekends? The availability of such a test might facilitate more family visits in apartments now with colder weather has arrived.
It's a great question, Barb, and I'm going to start by sharing some efforts that are already underway to allow residents to get together and have more socialization. At both communities, we introduced earlier in the fall dining together outdoors. And that was our first step to say, can we find a way to bring small cohorts of residents together and allow them to have that wonderful, treasured time to sit down and share a meal together? That's been underway. We're also working towards Thanksgiving at both communities where we would have seating together in small groups for Thanksgiving meals. And so we're continuing to do what we can to find safe ways for residents to socialize among each other. With respect to the testing, Dr. Gloria reviewed the different types of tests that are out there, and I've mentioned a couple of times that it is a full court press for Goodwin House to try to obtain the rapid test. You hear a lot about them in the news, but they're not as readily available as one might think. At least the ones that we would feel would have a high enough accuracy rate for us to have confidence. The other thing that complicates all this is that when we undertake testing, we're required to report the results. So it's not as easy as just giving a family member the test. They test negative and then they can go see their parents, their aunts, their uncles. We have to go through a whole procedure in that moment in time and record that and file that with the Virginia Department of Health. So there are some added complications. They're not insurmountable, but they're complications that we have to work through to be able to administer tests to family members to make that immediate access onto our campuses possible. In the question, there was also a point raised about whether family members, if they had a negative test, could go up to the apartment of the resident. We actually have a protocol that has been approved by the infection precaution and planning team that would allow that. We have not activated that protocol at this point in time because of the surge in cases and the increase in the regional positivity rate. So if the surges were to come down, if the regional positivity rate were to come down and our medical directors to feel that it were safe to activate that protocol with screening, with negative tests, we already have it approved and in place, and we could activate it.
Thank you. And another question posed towards you, Lindsay. My husband and I have no illusions about the perilous dangers of the autumn COVID surge amidst this pandemic in the juxtaposition with the annual influenza season. Can clever, forward-thinking, creative minds in management come up with potential solutions to assist the residents at Goodwin House?
Gosh, I hope that after having heard a lot of this, the residents would see that the management effort and the medical effort that we have brought to bear and the investment with the full support of the Board of Trustees to come up with creative solutions, that they see that that's in place. There's no doubt that there are other senior living communities that are choosing not to test guests and visitors, that are allowing a more relaxed flow of visitors onto campuses. Goodwin House has chosen to err on the side of being very conservative. And I'll go back to that earlier comment that we must be safe first before we can be safely social. So residents should anticipate that we'll continue to emphasize the safety factor while doing everything we can to make more socialization among residents possible and more interaction with residents and their loved ones and friends. I can also share with you that we're currently exploring ways to take the wonderful concerts and outdoor activities and bring them safely inside during the winter. And think about the fact that you may have an hour-long concert. But what if we were to split the concert in two parts and allow the maximum number of residents to be in an auditorium, socially distanced with masks, and they'd get to hear the concert? Then we would have them out. We would bring in our Solaris UV machines, do a cleaning, and then another group of residents could come in and hear that concert for a live event. So we're exploring a variety of ways that we can increase the engagement and socialization among residents and with their families and loved ones.
And Lindsay, the last question for you. I have been observing a greatly increased number of people whose masks are not covering their noses, including those accompanied by staff. Just telling people to correct this doesn't work because the masks themselves are too loose and folks don't seem to be aware. Why not have a staff person check each person's mask for fit and figure out how to correct the problem? I have also noticed several people who are wearing bandanas. I thought this was considered unacceptable from the CDC.
It's a very good question, and a couple of responses. The first is there is something called mask fatigue, and it's not unique to residents in our communities. It's something that health authorities are concerned about and continuing to encourage people to be very vigilant with wearing your mask, wearing the proper mask, and wearing it properly. With respect to residents, we know that over time, masks may stretch. Even a cloth mats and the rubber bands behind the ears may start to stretch, and it just gets looser and it's harder to keep it safely fitting. At Goodwin House Bailey's Crossroads, they undertook a test of distributing masks to residents and showing them how to properly wear that. That seemed to really help, and we're going to be bringing that effort to the Goodwin House Alexandria campus. So we're hearing you and we're responding with new efforts. In addition to that, we'll soon have a dedicated staff member at both communities who's focused solely on the screening as people are coming in, whether it's visitors or staff members. And those individuals, those two individuals, one at each community, are also going to be focused on correct mask wearing encouragement as they might see a resident, or it could even be a staff member that isn't properly wearing their mask. So We're, if you will, increasing our efforts quite a bit to ensure that that basic of precautions is really, really well practiced in our communities.
Great. And I'll be happy to answer the next two questions. The first one is, how will you be encouraging residents to exercise when it is too cold or icy to walk outside? Is there an exercise room? Will it be open, and what will be the capacity? So our plan currently is to keep all of our fitness centers and pools open in both communities. Fitness classes will continue to be displayed on in-house channels, and we also offer personal training at both communities for any resident that is interested. The next question is, if COVID restrictions prevent visits with family for Thanksgiving and/or Christmas, could you elaborate on what life at Goodwin House would look like? How might you be trying to provide some sort of social engagement on these days? Will residents be able to gather amongst themselves? Well, our Thanksgiving protocol will have been distributed by the time you listen to this webinar. And we do have information, and it will be on our internal channels. However, we do intend to offer a Thanksgiving banquet featuring full table service, including china, silverware, and stemware, and a seasonally decorated dining room with music. We'll also provide room service delivery and an upscale seasonally themed bag and holiday meals to go. Independent residents may leave the community to dine with their families, and they will be provided with CDC guidelines for safe Thanksgiving protocols. And we have one final question, and Lindsay, this one is for you. Since family and visitors are not allowed inside the Goodwin House campus now, would it be possible to post weekly pictures of activities and snapshots of residents on a site accessible to family members so we can have some sense of continuity in how our family members are socializing and what's going on there?
That is such a great suggestion. And the answer is yes, yes, yes. We actually started posting photos in our weekly staff update. And we're going to be posting photos in the Friday resident update and the Friday family and friends update that goes out every Friday evening of life on campus and the many ways that our residents are engaging with each other, the ways they're engaging with staff. And absolutely, we want to do that. It's a wonderful suggestion. And please keep those good communication suggestions coming forward. We welcome them. We want to make sure we're doing all we can to help bridge the gaps with our residents and their loved ones.
Thank you, Lindsay. Well, this concludes our program. Thank you, residents, for submitting such thoughtful questions and your interest in this COVID-19 briefing. If this briefing has sparked new questions, please feel free to submit your questions to Jane Rossman at Goodwin House Alexandria and Jamie Blank at Goodwin House Bailey's Crossroads. Lindsay and Dr. Gloria will provide answers which we will publish in writing and distribute to residents. In addition, if there are ways in which we can better support, honor, and uplift you right now, please contact Jane or Jamie or one of our social work teams. We are here for you. This concludes our briefing on COVID-19 and Goodwin House's efforts to keep us all safe and engaged. Thank you.